Good afternoon, greetings from Lisbon, Portugal. My name is Filipe Lopes, and I would like to start by thanking the organization for the opportunity of presenting this work, which was performed by a team that I am honored to be part of. That is the translation and validation of the Portuguese version of the International Consultation on Incontinence Questionnaire Bladder Diary. This study was developed at Hospital Santa Maria in Lisbon, Portugal, in close contact with the Bristol Urological Institute. I have no conflicts of interest to disclose. A bladder diary is a non-invasive tool in which a patient is asked to describe his or her drinking and voiding habits. The use of bladder diaries is highly recommended by both European and American urological guidelines, but before their use, proper translation and validation needs to be done in order to certify that the information obtained in the diary is accurate. This is the ICIQ Bladder Diary, a 3-day diary which measures the time and volume of fluid intake and urine output. It measures also the use of pads or diapers, incontinence episodes, and waking and sleeping times. It also features a bladder sensation scale which asks the patient to describe his or her urgency feeling immediately before voiding. This diary was published in 2014 and was the first standardized diary validated using the psychometric protocol of the ICIQ. The goal of our work was to translate and validate this diary to the Portuguese language. The translation of the bladder diary was performed by a team of urologists from our department with certified English knowledge, after correspondence with the ICIQ. The translated bladder diary was then back translated to English by an English native speaker whose daily work was not associated with health. And we compared this back translated version with the original one. The only differences were basically synonyms, and all the sentences had exactly the same meaning, and therefore we accepted the Portuguese translation of the bladder diary and continued to the validation tests. The validation process was comprised of primary tests and secondary tests, which I'll describe further. In order to evaluate the Portuguese version of the ICIQ Bladder Diary, we asked 140 patients followed at our department to fill 4 documents that were the informed consent, the Portuguese version of the ICIQ Bladder Diary, the Portuguese version, a validated version, of the ICIQ Overactive Bladder Questionnaire short form, and a questionnaire which evaluated the difficulty in filling of the bladder diary. We also asked a group of 30 patients to fill a second bladder diary 2 to 6 weeks after the first, with no intervention, no treatment between them, and another group of 30 patients which were proposed for intravesical botulinum toxin injections filled a second diary 4 to 6 weeks after the first one to compare them. Patients under 18 years old or unable to give informed consent were obviously excluded. These are the overall data obtained from the bladder diary, in which we can see that the studied population had a mean age of 65.5 years. We included 122 patients of the proposed 140. The other 18 patients were excluded, mainly because they didn't return the diaries or any of the other documents I mentioned before. Other details are available in this table. Here we can see the results of the first test, the content validity. For this, we designed the questionnaire in which we asked the patients the difficulty they felt in filling the columns of the diary. The large majority of the answers were 1 or 2, which mean no difficulty or low difficulty, and so we concluded that it is a suitable and easy to use tool. Interestingly, the bladder sensation scale was considered as the most difficult item, with 32% of patients answering 3 or more in a scale of 1 to 6. The internal consistency was calculated using the Cronbach's alpha, with a result of 0.78, and this value was practically unchanged with the exclusion of each of the items, showing a good internal consistency. Next, we have the test-retest reliability. As I mentioned before, a group of 30 patients were asked to fill a second diary 2 to 6 weeks after the first, in order to test the reliability of the diary. This was assured since Pearson's correlations of each of the items was very high, with the exception of bladder sensation scale 2 and 4. Going into the secondary tests, the construct validity was also established. Here we tested this item by seeing if 3 overall accepted premises applied to the studied population. The theories were that incontinence is more common in female patients than in males, that the prevalence of nocturia is higher in older patients, especially over 60 years old, and that incontinence is more common in patients aged over 60 years. The 3 premises were statistically proven in our population. The criterion validity tested whether the information obtained through the bladder diary was consistent with the one obtained from another validated source. In this case, we used the OAB questionnaire short form. Here we find that moderate correlations were observed, and we noted that the bladder diary seems to be more sensitive than the OAB questionnaire in detecting these kind of symptoms. The last test was the responsiveness, in which we evaluated whether the information obtained in the diary changed with an intervention aimed at treating LUTs. In this case, patients undergoing intravesical injection of botulinum toxin filled the first bladder diary before and a second bladder diary after the intervention. The change in almost every parameter of the bladder diary was observed, which suggests that the bladder diary is sensitive to symptom change. In conclusion, we report the validation of the Portuguese version of the ICIQ Bladder Diary after successfully translation and validation tests. Its publication is currently under evaluation and we expect it to be published shortly. Thank you.